All right. Good evening, everyone. Thank you for joining us tonight for part 2 of our 4-part Medicare 101 series. A couple of quick housekeeping items to cover before we get started. We have a lot of information to go over tonight, and I'm going to try and get through it as quickly as I can. However, there will always be time for questions, and I will pause at different intervals during the presentation and take questions. When I am taking questions, you are welcome to simply unmute and ask your question at that time, or you're welcome to type your question into the chat box at any time, and I will address those questions when I do pause during the presentation. Hopefully everybody received a copy of the email that I sent earlier this afternoon that included a copy of this presentation, as well as some additional handouts that I will be referencing during the presentation, and simply for you to have for your own information. If you did not get that email and would like it, please type your name and email address into the chat box, and I will make sure you get that sent to you. I think that's everything I wanted to cover real quick. So, looks like we've got quite a few people joining us tonight. So again, thank you so much for taking time out of your evening to join us tonight. This is part 2 of our Medicare 4-part series of Medicare 101. Tonight, we are going to be talking specifically about Medigap, also known as Medicare Supplement Insurance, and Medicare Advantage plans. So just to review, I am with the Pikes Peak Area Agency on Aging, and the mission of the Area Agency on Aging is to work with partner governments in our 3-county region of El Paso, Park, and Teller counties to develop systems and programs that are designed to help people stay in their homes in the community for as long as possible. Within the Area Agency on Aging, I am the coordinator for the local SHIP program. The SHIP program, which stands for State Health Insurance Assistance Program, is a federally funded program that's designed to provide free and unbiased information, education, and assistance on all things Medicare. We are true consumer advocates. We do not sell or endorse any specific insurance companies or products, and we are here to help people understand what their options are as it relates to their specific situations. The SHIP program is centered here in Colorado Springs, but our office covers a total of 9 counties in Colorado. Counties are listed on the slide. Every county has access to a SHIP program in their state, if nothing else by toll-free statewide number. I've listed both our local Colorado Springs number as well as our statewide toll-free number for your information. But again, every county and every state has access to a SHIP counselor within their county. So just a quick review of what we covered last week. We talked about Medicare A and B, who is eligible, how to enroll, what Medicare Parts A and B cover as far as benefits, and what they cost. Medicare Parts A and Part B are referred to collectively as your original Medicare benefits. And again, tonight, we are going to talk about Medicare supplements, or Medicare, also known as Medigap, and Medicare Advantage plans, sometimes referred to as Medicare Part C. So these are the options that are available to anybody who has become enrolled in Medicare, whether it's based on turning age 65 or based on having become disabled per Social Security. Anybody who is currently enrolled or is going to be enrolling in both Medicare Parts A and Part B are eligible to enroll in either a Medicare supplement or Medicare Advantage plan. Both kinds of insurance are regulated by Medicare, and there are limited time frames or time periods, also known as enrollment periods, when you can get into this kind of insurance once you're enrolled in Medicare. We're going to start by talking about Medicare supplements, or also known as Medigap coverage. Medicare supplement and Medigap are two terms for the exact same insurance. So it's just two terms for the same product. I tend to use the phrase Medicare supplement more often than not, simply because I've been doing this a really long time, and Medigap is honestly more of a newer terminology. So I tend to use this Medicare supplement language. So what is it? Well, Medigap insurance or Medicare supplement is a private insurance policy that you purchase from a private insurance company, but it is solely and specifically designed to supplement original Medicare A and B. And what I mean by that is it's specifically designed to pay the balance that may be left over after Medicare Part A or Medicare Part B pay their part first for any medical claims that you may incur. Even though these are private policies from private companies, they are still required to follow all federal and state laws that are designed to protect you. If you purchase a Medicare supplement policy or Medigap, that policy, that paper copy of the policy must say Medicare supplement insurance, those three words in that order on the policy. The phrase Medigap comes from the thought process that it covers the gaps in your original Medicare coverage. Medigap insurance is sold by different levels of coverage, and these levels of coverage are considered standardized, meaning every company that sells this kind of insurance in every state in the country is required to cover or to offer the same levels of coverage. So all companies selling this kind of coverage anywhere in this country, they're all selling you the exact same levels of coverage, the exact same options. With the exception, there are 3 states currently in the country that offer additional options: Massachusetts, Minnesota, and Wisconsin. Even though all companies are required to offer the same standardized options or levels of coverage, that coverage, regardless of what option you choose, will vary in cost by the plan that you choose, the company you purchase it from, and the zip code that you live in. Premiums can also be determined based on whether you're male or female. It can be based on whether you're a smoker or a non-smoker. So there are a lot of factors that go into how much the premium may be that you would be charged if you purchase this kind of coverage. Medigap insurance or Medicare supplement only works if you are enrolled in both Medicare Part A and Medicare Part B. You have to be enrolled in both parts. There are some scenarios where you may not need to think about purchasing this kind of coverage. For example, if you are already enrolled in a Medicare Advantage plan, you cannot purchase this kind of coverage, or other types of Medicare insurance plans. You may not need this kind of coverage. If you have other forms of creditable health insurance coverage, such as if you're a retired military and you would have access to TRICARE for life, if you are retired federal civil service or retired public employee, both of those entities offer health insurance benefits for their medical Medicare retirees who enroll in Medicare that are specifically designed to coordinate with Medicare. Other private companies may also offer health benefits that are designed to coordinate with Medicare or work directly with Medicare for their retirees. So I always encourage people who have the opportunity or the option of a retiree health benefit to look at those benefits carefully and determine whether or not those benefits are going to be as good as or better than what you could purchase as a Medigap or a Medicare Part C out in the open market. With this kind of insurance, because original Medicare A and B are your primary insurance in this situation, and the Medigap insurance is your secondary insurance designed to pay anything that Medicare A and B left over, Medicare is the controlling factor of who you can see and where you can go for services in the United States. So Medicare is good with pretty much any provider for any medically necessary service anywhere in the country that Medicare is accepted. As long as Medicare pays their part and you have a Medigap or supplement policy in place with Medicare, that supplement policy will pay the balance that Medicare left over. So it makes this combination of coverage in particular, Medicare and a Medigap, the most portable kind of coverage to have, which can be important if, for example, you snowbird between Colorado and another state, if you intend to travel for extended periods of time. Again, it's the most portable because it's good anywhere in the country that Medicare is accepted. And as long as Medicare pays its part, the supplement or Medigap will always pay its part. So who can get a Medigap? Well, pretty much anybody. Like I said, anybody who is enrolled in Medicare Part A and B. There are times that are better to try and get this coverage than other times. And that is going to primarily be surrounding the actual initial enrollment into Medicare. So when you are becoming eligible for Medicare, when you enroll in Medicare for the very first time, whether that's based on turning 65 or based on disability at any age, when your Medicare, both Medicare A and B are actually in effect, that will trigger what's called the guarantee issue period for a Medigap. A guarantee issue period for a Medigap is a 6-month window from the time your Medicare goes into effect. It's a 6-month window when you are able to purchase a Medigap policy, any level of coverage from any company that's selling it without any question. You're guaranteed to purchase any plan you want from any company you want. Guarantee issue period. And again, that lasts 6 months. It starts as soon as both A and B are in effect. Outside of this 6-month window, you can still try and purchase this kind of coverage at any time for any reason. But outside of that 6-month window of guarantee issue, when Medicare first kicks in, you could be subject to underwriting. And what that means is the insurance companies would be allowed to potentially turn down an application if you have pre-existing health issues that they don't like and don't want to insure. That can be especially important for people who are becoming eligible for Medicare based on Social Security disability. In the state of Colorado, the state of Colorado requires that the insurance companies that sell this kind of coverage provide that same 6-month guarantee issue period for people just enrolling in Medicare based on disability. It's important for people under 65 because typically that if you're getting Medicare and you're under 65, that typically means that you have been approved for Social Security disability, which typically means that there is some sort of pre-existing health issue. Because there's a pre-existing health issue outside of this guarantee issue period, you're likely to be denied if you try and purchase this kind of coverage from any of those companies. Even though Colorado provides that guarantee issue for people under 65, do be aware that those plans will be a little more expensive than if you were purchasing this coverage at age 65 because you're under 65. So the premiums are going to be higher, even though you're guaranteed to be able to purchase this coverage. But on the plus side, whether or not you purchase this kind of coverage when you get Medicare under 65, when you turn 65, you get a second 6-month window of guarantee issue to purchase this kind of coverage again at a lower rate because now you're over 65. So keep that in mind if you are on Social Security.
Got a question.
Sure.
What if you are, you're currently employed, you remain employed till you're 68, and from last week, I understand you don't need to get Medicare until, you're not covered. So let's say you turn 68, then you apply for Medicare A and B. Does that 6-month window still exist here, or does it have to be done at 65?
Nope, absolutely. So that 6-month window of guarantee issue starts the very first time your Medicare A and B go into effect, regardless of age. So if you are able to delay enrollment into Medicare in favor of active employer group coverage, that's fine. As soon as you actually enroll in Medicare at any age when that group coverage ends, that's the first time your Medicare A and B go into effect. That's when your guarantee issue period starts.
Question.
Now,
Thank you.
even for people who enroll in Part A but continue to work with employer coverage, when you quit working and you actually go to enroll in Part B for the first time, because that will be the first time both A and B are in effect at the same time, the same applies. You still get that 6-month guarantee issue window because that's the first time both A and B have actually been in effect together. So again, because you have to have both A and B to get this coverage, that 6-month window starts when both A and B go into effect, even if those are at different times.
I have a question.
Sure.
Regarding James' question, but you must apply for Part A, correct? At 65, you must apply for Part A.
No,
You don't
You're
have to apply at all?
if you are still actively employed with employer group health coverage when you turn 65, you can choose not to enroll in any part of Medicare whatsoever. You just pretend like Medicare is not in existence. You keep on working with your employer coverage.
With no penalty?
No penalty. When you decide that you're going to stop working, you can contact Social Security at any time while you are still working or up to 8 months after that employment ends and enroll in both A and B without penalty.
Okay, in my situation, I'm not working, my husband is, and he has the insurance. So does that still apply?
Correct. If you are the person working or the spouse of the person working covered under that same employer coverage.
Okay. Thank
Okay.
you. And what if I apply for Part A?
So
What
again,
happens?
if you go ahead and enroll in Part A when you're first eligible for Medicare, but you continue to stay on the active employer coverage, that's perfectly fine. And again, Social Security strongly encourages people to enroll in Part A because for most people, there is no monthly cost. There's no premium. Just like we talked about last week, you earn that benefit through work. But that all these guarantees and all these enrollment periods don't really start until both A and B kick in together. So until you enroll in Part B, you don't have to worry about any enrollment periods or penalties or anything like that.
Good to know. Thank you.
You're welcome.
And Crystal, could I go on a little bit of a variant from that?
Go ahead.
I got Medicare A and B 14 years ago because I came down with kidney disease.
Okay.
I did not have a Medigap because I was still working and I was using my employer's health insurance as a secondary.
Okay.
Now I'm getting ready to retire.
Uh-huh.
And I'd like to look at a Medigap policy to go with A and B.
And you've been covered by your active employer coverage, the same active employer coverage the entire time?
I've been covered by my active employer coverage, but also Medicare.
Okay. And as the employer more than 20 employees?
Oh, yes.
Okay. So that's fine too. So if you went ahead and enrolled in both A and B, excuse me, A and B of Medicare were secondary benefits to your employer plan.
Correct.
When that employment ends, you still get a guarantee issue into a supplement. You get a window of opportunity to enroll into an Advantage plan or Part D plan, but they are smaller windows of opportunity.
Okay.
So because you've been enrolled in A and B, when you stop working and you are no longer covered under that employer health coverage, you will get a, well, actually in Colorado, they changed the law. In Colorado, you would get 6 months of guarantee issue if you involuntarily lose your employer plan. But if it's voluntary loss of employer coverage, you get 63 days of guarantee issue into a Medigap.
Okay.
You also get 60 days to enroll into a Part D order or an Advantage plan in that scenario. If that's
Okay.
the direction you go in.
little tighter window, but at least I have one still. So
Correct.
that's very good news. Thank you.
Correct. You're welcome. So again, obviously for many people, that is going to be the best window of opportunity to purchase a Medigap policy is during that first 6 months of guarantee issue when Medicare first kicks in. This is also sometimes referred to as the Medicare supplement open enrollment period, although I don't like that terminology, it makes things confusing. Again, the 6-month window starts the same day both A and B are in effect. Once that clock starts ticking for that 6-month window, you can't stop it. Once it expires, it's gone. So, you know, you have that 6-month window, you can wait till the very last month of that 6 months, but as long as you enroll in this kind of coverage within a 6-month window from when A and B go into effect, you're guaranteed coverage, any level of coverage from any company you choose with no questions asked. They cannot turn you down for any reason whatsoever. If you miss this opportunity for whatever reason, and you go to try and purchase this kind of coverage without that 6 months of guarantee issue, if you are healthy enough to pass underwriting, and when I say underwriting, again, what that means is these companies are going to be allowed to look at your application. There are health questions on the applications. You answer those questions honestly. They're going to look at the application, at those health questions, and if they decide there are too many health issues for them to want to insure, they'll turn your application down. If you're healthy and they like the answers of those health questions on the application, they'll accept you and they'll sell you a policy. For people who are healthy and can pass the muster when it comes to answering those questions on an application, you can switch different levels of coverage. You can switch to different insurance companies for this kind of coverage as often as you want, as often as you're able. There is no annual enrollment period for this kind of insurance. You get the 6-month window when Medicare first kicks in, and that's pretty much it. There's no annual enrollment period. There's no annual opportunity to look at different levels of coverage or different companies and make a plan change like there is with other parts of Medicare insurance. So this is pretty much for some people, especially if you have pre-existing health issues, this is basically an all or nothing kind of opportunity. Because again, if you can't pass underwriting, they're not going to sell you insurance. Now, the only way that they can look at your health history is based on those questions. You do not take physicals. You do not have to see a doctor to pass underwriting with this kind of insurance. They're going to take you at your word based on the answers of the application. But again, I caution you to be honest in those answers, because if you are not, and they find out after the fact, it's going to cost you a lot of money. So keep that in mind. If you're healthy, you can buy this kind of coverage all day long, anything you want. If you're not so healthy, that 6-month of guarantee issue is pretty important if this is the kind of insurance you are interested in getting. Now, as with all things Medicare, there will always be exceptions to this rule. And there are other opportunities that may present themselves in the form of special enrollment periods, which may also provide limited timeframes for future guarantee issue periods. And we will talk about those coming up. So a special enrollment period into this kind of insurance, meaning you're outside of your 6 months of guarantee issue, but somehow, some way you're being presented with an additional opportunity to buy this kind of insurance without underwriting, is typically going to be surrounding some sort of involuntary loss of other coverage. So if you are laid off from a job and you lose that employer coverage, whether you've been enrolled in Medicare or not, that's considered involuntary loss of coverage. If you've been on COBRA and that COBRA coverage ends through no fault of your own because COBRA is limited time coverage, that would provide involuntary loss of coverage and a small window of opportunity to be guaranteed into a Medicare supplement. The most common way someone can be guaranteed into a supplement is based on having enrolled in a Medicare Advantage plan and using what they call the test drive. We'll talk about that in much more detail when we get to the Medicare Advantage plan section of this presentation. So we'll wait to talk about that a little bit more. So again, this kind of insurance policy is designed solely and specifically to pay any balance that was left over after Medicare Part A paid their part first, or Part B paid their part first. So as we talked about last week, Medicare Part A for, say, hospitalization covers everything except for that Part A hospital deductible. Medicare supplement is designed to pay that deductible. For outpatient services, office visits, and x-rays and lab work and such, Medicare Part B, after the initial $223 deductible, pays at 80/20. The supplement is specifically designed to pay that 20% balance that Medicare didn't pay. So theoretically, between original Medicare A and B and a supplement, you could have almost 100% medical coverage. But this kind of insurance only pays if Medicare pays first. So if there is something that Medicare does not pay for, or is denied by Medicare because it wasn't necessary, the supplement is not going to pick up that balance. Things that would not be covered specifically by Medicare supplements are going to be anything that's considered long-term care or custodial care, dental and vision benefits, because those are currently still not actual benefits of original Medicare, hearing aids or the fitting of them, private duty nursing, and outpatient prescription drugs. And the outpatient prescription drugs will fall under the Part D benefit that we talk about next week. But again, even if you receive a service that Medicare would typically pay for, but Medicare determines that that service wasn't really necessary when you received it and denies paying for it, the supplement is also going to deny paying any part of that. It is not designed to pick up balances that Medicare won't cover. It's designed to pick up balances Medicare left over after they did cover something. Okay, so any questions about any of that? Again, if you have a question, you can unmute or type it into the chat box. Okay, so again, in the email that I sent out earlier this afternoon, I included several handouts, and this is one of those handouts. In the state of Colorado, we are very, very fortunate that our Division of Insurance up in Denver takes the time and the energy to put this particular handout together. Not many states have a Division of Insurance that will do that for them. So this handout, even though it says Medicare Supplement Insurance Policies for September of 2021, is the most current document available right now. They are currently working on the next update for this particular handout, but it probably won't be available again until this coming September. This handout is pretty much going to give you a brief overview of everything I just talked about in the first half of it. It's like a 10-page handout. So the first half is going to give you a brief overview of everything I just covered. The second half of that handout is going to give you a listing of every company licensed to sell this kind of insurance in the state of Colorado. It's going to list those companies in alphabetical order, and it's going to list those companies in alphabetical order based on different age groups. So this is an example of the first page of the second half of this handout that is listing all the companies licensed to sell this kind of insurance in Colorado. There are over 40 companies that sell this kind of insurance in Colorado. So each page in alphabetical order is going to be front and back listings. And it's going to be a tool for you to use that's going to give you an idea of how much this kind of insurance costs with each company. I also included this handout. This is a handout that outlines the different levels of coverage available to purchase as a Medicare supplement. So I mentioned that this kind of insurance has different levels of coverage that are standardized, meaning every company in the country are selling the same levels of coverage. Well, these are those levels of coverage. They're labeled A through N, and they're called plans. Not to be confused with Medicare parts. These are supplement plans. So plan A, B, C, D, F through N. Yes, there are gaps in the alphabet here because these plans recently changed about, well, I guess it's been a while now. It's been over 10 years. So the plans used to be A through J, like the alphabet. In 2006, they removed 3 plans, and instead of just changing the H, I, and J, they just kept going on up the alphabet. So now we have A through N, and each plan, such as Plan G or Plan N, is a different level of coverage, and each level of coverage provides specific benefits that it will pay after Medicare A and B pay their part first. So we're going to go over this real quickly so that you understand what these plans cover. So again, we've got A through N. If we look at the first plan, A, Medicare supplement, to go with your Medicare parts A and B, you'll notice that under Plan A, it only describes basic benefits, which include the 100% of the Part B coinsurance, the 20% Medicare left over for Part B services. If you buy supplement Plan A to go with your Medicare Part A and B, that's all it's going to pay after Medicare is the 20% Medicare left over for Part B services. It's not going to pay your hospital deductible or anything else. If you go up to the next plan, Plan B, it's going to pay that 20% for Part B services that Medicare left over. It's also going to pay your Part A inpatient hospital deductible every time you're admitted to the hospital. So it pays 2 benefits after Medicare. I'm going to jump over to Plan D, Supplement Plan D. Supplement Plan D covers the 20% for Part B services, covers the Part A inpatient hospital deductible every time you're admitted. It also covers skilled nursing facility coinsurance. If you remember from last week, if you are inpatient in a hospital and then discharged to a skilled facility, Medicare pays 100% for the first 20 days of that facility stay. But starting at day 21, Medicare starts applying a coinsurance of $94.50 or $194.50. Sorry. That $194.50 that Medicare is not going to pay for days 21 through 100 is called a coinsurance. If you have a Plan D or higher, it pays that $194.50 per day starting at day 21. And then the very bottom for Plan D, it also has a foreign travel emergency provision. Medicare itself, A and B, does not cover you if you cross the border of the United States of America and or our territories, with a few exceptions. So there is no foreign travel benefit if you go out of this country. Medicare does not go with you. But the foreign travel emergency provision within a supplement policy is designed to help reimburse any medical expense you may incur if you are in a foreign country and you have a medical emergency. So basically, it's not insurance while you're in a foreign country, but it is reimbursement if you have a medical emergency if you're in a foreign country. And basically, the way it would work is, if you are in a foreign country, you have a medical emergency, you pay for that emergency while you're there or experiencing it. When you get back home, you can take that receipt or that bill, and you're going to have to submit it to Medicare for denial so that the supplement insurance sees that Medicare is not going to pay for it. You submit the Medicare denial and the original receipt from the emergency to your supplement. They are going to reimburse you up to 80% of the cost of that emergency after a $250 deductible. So it's going to reimburse a good chunk of the cost of any medical emergency you have in a foreign country, but is not going to cover you while you're in that foreign country. You'll notice a few of the plans offer that benefit, but not all of them. So again, if you go and purchase a supplement Plan D, It's going to pay the 20% after Part B services that Medicare left over. It's going to pay skilled facility care stay starting from day 21. And it's going to cover your inpatient hospital deductible every time you're admitted. These benefits are going to pay every time Medicare pays. And that's what you're getting under Part D or Plan D supplement. Going to jump again to Plan G supplement. Pretty similar to Plan D. Covers the 20% for Part B services, covers skilled care starting at day 21, covers inpatient hospital deductible. Has that foreign travel emergency provision, but it also includes an extra benefit called Part B excess. Part B excess is not a benefit that you would necessarily need to access on a regular basis, and it refers to how Medicare pays doctors, basically. So what it refers to basically is how a doctor accepts you as a Medicare patient and accepts payment from Medicare. Most doctors who take Medicare and Medicare patients take it under the provision of what's called Medicare assignment. And what that means is that doctor is willing to take whatever Medicare assigns as payment for their service as payment in full. So the way that would work would be, say you go to your primary doctor for just a regular office visit. If you didn't have any insurance whatsoever, you're just walking off the street paying cash, that doctor would charge you $300 for an office visit. But you have Medicare. So you go in for that office visit, that doctor is going to bill Medicare his retail price of $300. Medicare gets that claim and Medicare turns around and says, this type of office visit is only worth $100. So Medicare pays 80% of that $100 that they have assigned for that service and pays that doctor $80 directly. So they're paying 80% of the $100 they assigned. In that situation, that doctor knew that even though he's going to bill Medicare $300, he knew he was only going to get $100. That Medicare was going to cut that down to $100 and pay him 80%. That balance of $20 or 20% is going to go to the supplement. The supplement's going to pay the doctor directly. The doctor gets paid a total of $100 for that service. That doctor accepts Medicare assignment. He accepts whatever dollar amount Medicare assigns for that service as payment in full. In that situation, the doctor bills Medicare directly as required by law. Medicare pays the provider directly. The supplement pays the provider directly. That doctor takes assignment. The other kind of doctor that you can come across are doctors that do not take assignment. Basically works the same way. You go in for an office visit, that doctor is going to bill Medicare his $300 retail price. Medicare is going to turn around and assign $100 for that service and pay 80%. The difference is that doctors that do not take assignment are allowed by Medicare to charge you, the patient, 15% more than what Medicare assigns for that service. Keep in mind that Medicare already has a predetermined dollar amount assigned to any medical service that they will cover. So it's already predetermined what Medicare pays for anything. So when a doctor does not take assignment, he still knows how much Medicare is going to assign as payment in full for a service. So he bills Medicare $300, Medicare assigns $100, pays 80%. But because that doctor is allowed to charge you 15% above the $100 Medicare assigned, that doctor is typically going to ask you to pay $115 while you're in that office. You're going to pay upfront. So you're going to pay the doctor $115. That doctor is still by law required to bill Medicare for you. When Medicare gets that claim, he's going to see that that doctor is not assigned and assume that you've already paid the doctor $115. When Medicare processes that claim and cuts that check for $80, 80% of $100, that check is going to be mailed directly to you. When Medicare sends the balance of 20% over to your supplement, the supplement is going to cut you a check for $20. So you are going to get reimbursed directly by Medicare and your supplement because they're going to assume that you already paid that doctor upfront. That extra 15% you paid that doctor upfront is called Part B excess. So if you are in a situation where you have a provider that makes you pay upfront but still bills Medicare, that is probably why. Some doctors' offices may have a sign in their lobby that says, you know, we require Medicare payment upfront. That's a good clue that this provider may not accept assignment. But again, it's not very common in the Colorado Springs area. It may be more common in other parts of the country or the state. If you have a Plan G supplement that includes this Part B excess benefit, not only will it pay the 20% Medicare leftover for that claim, for that $100, Medicare paid $80 and the supplement pays $20, but the supplement would also pay that extra 15% you paid up front as a Part B excess benefit. So hopefully that makes sense. Again, not common, but it might be something you come across. The next several plans, plans K, L, and M, are going to be benefits that are paid at slightly lesser than 100% after Medicare. So plans K and L pay the Part B 20% balance at 50 or 75% of that 20%. They pay the skilled nursing facility coinsurance starting at day 21 at 50 or 75% of the balance. They pay the inpatient hospital deductible every time you're admitted at 50 or 75%. Because these two plans specifically do not pay 100% of the balance left over by Medicare, they only pay a percentage of it. These plans tend to be much lower in premium, and they do have maximum out-of-pocket limits, meaning after Medicare pays their part and these plans pay their 50 or 75% of the balance, and you pay the rest, if within a calendar year what you've paid that the insurances didn't pay equates to either $6,620 for a Plan K or $3,310 for a Plan L. If you actually pay that out of your pocket before or within a calendar year, then that plan would be required to pay 100% for the rest of the calendar year for any services. Not likely to happen, and it would be a rare scenario that you would hit those max out of pockets, but that's how those would work. Plan M, as in Mary, pays 100% for Part B services, the 20% balance, pays 100% if you have to go into a skilled facility after a hospital stay, but it only pays 50% of the hospital deductible. It does include that foreign travel emergency provision. Plan N, as in Nancy, is becoming pretty popular as well. It pays 100% for Part B services after Medicare pays first, for everything except for any sort of office visit. It applies a $20 copay, and any emergency room visit, it applies a $50 copay. All other services covered by Medicare, it pays 100% of the balance. It pays 100% for skilled facility coinsurance, and it pays 100% of your Part A hospital deductible, and it includes the foreign travel provision. So again, this Plan N pays almost 100% after Medicare for all those services, but under Part B, it would deduct $20 deductible for office visits of any sort, or $50 deductible for any emergency room visit of any sort. These last four plans do tend to be much lower in premium because they do not pay 100% after Medicare in benefits. But that's why, because they don't pay as well as the other plans that we talked about previously. These are your levels of coverage to choose from. This is the coverage you can purchase. Now I skipped over Plan C and Plan F for a reason. If someone is becoming eligible for Medicare at any time after, let me rephrase that. If you are turning 65 and becoming eligible for Medicare for the first time, or if you're under 65 and you're eligible for Medicare for the first time after January 1st of 2020, you do not get the option of picking Plan C or Plan F. Those are not on the table for you. You can choose A, B, D, G, K, L, M, and N. If you were eligible for Medicare prior to January 1st of 2020, whether you enrolled in Medicare or not, you have the option of also looking at purchasing a Plan C or a Plan F. The only difference between a Plan C and a Plan D, they cover the exact same benefits, except that Plan C also covers the annual Part B deductible. Again, we talked about last week, $223. The only difference between a Plan F and a Plan G, again, is that Plan F pays the annual Part B deductible, Plan G does not. The reason that you are not able to choose from Plan C or Plan F if you are eligible after 2020 is because the government has decided that those plans were too good. They gave too much coverage. So specifically Plan F, if you had original Medicare A and B and a Plan F supplement, you literally had 100% medical coverage. And that was too good. It was considered first dollar coverage, and it did not, the government felt at the time that it did not provide you enough incentive to be more careful with using your benefits or some such thing. So Plan F is no longer available for purchase. Plan C is no longer available for purchase specifically because those plans paid the Part B annual deductible. On the other hand, if you had the opportunity to purchase a Plan F and you wanted to do so, I would suggest that you think carefully about that. Again, the only difference between a Plan F and a Plan G is that annual Part B deductible of $200 and some, but you might find that the premium difference between those plans is significantly lesser than that $223. So the premiums for a year for Plan G would far outweigh the savings or far outweigh a Plan F in savings, even when you add that $223 deductible back in. So it is more cost effective to do a Plan G if you have that ability. Again, these are your levels of coverage to choose from. I always encourage people to choose their level of coverage that they're going to be comfortable with for the long haul, for the rest of your life potentially, before you start shopping the prices. Do not pick a plan based on price alone. Pick a plan on the level of coverage you're going to want 20 years from now, and then shop around for the best price for that plan. And then again, that's where this is going to come in handy. So once you've picked your level of coverage, then you can start shopping around. Again, this handout is going to list all the insurance companies. It has A through N across the top, just like this previous chart. If you intersect the plan level, we'll say a Plan G. If you go down the line for Plan G and you intersect it with company X, we'll go with Humana. A Humana Plan G at age 65 is listed at approximately $211. $212 if you're a male. These prices quoted on this handout are not designed to be specific price quotes. They're designed to be ballpark estimates. So if you were to call up Humana and say, how much would a Plan G be? I'm just turning 65. You're going to probably get a different price quoted to you than what you see on here. But that price that's quoted to you over the phone should be within the ballpark of what you see on this handout. The point of this handout is more or less to show you what companies charge more and what companies charge less than it is to give you actual pricing. So it helps you shop around, helps you narrow down the companies that you would be more interested in contacting for an actual price quote versus just having to call them. Now you'll notice that every column under Plan A has a price quote in it. Almost every column in Plan F has a price quote, and there's a couple of companies that do not sell Plan F still. Every company sells a Plan G, there's a price quote, and almost every company sells a Plan N. All the other plans are kind of hit and miss. Some companies do, most companies don't sell any of those other plan options. And that's their choice. It may not be financially viable for them, whatever. The most popular plans are the plans that every company is going to sell. Every company sells a plan A, even though it's not adequate coverage, because they're required to by law. The law requires that if they sell Medicare supplements, they must sell plan A, and then they can pick and choose any of the other options they want to sell. So again,
Good.
this is
Got a
designed to
question.
kind of help you weed out the companies you don't want to look at. Go ahead.
Okay, Part B and these Medigap prices, can they change every year or are they set?
Insurance is insurance, just like your car insurance, your home insurance. Not only are the costs of Medicare going to change every year, so the premium for Medicare changes, the deductible amounts change for Medicare every year, the co-insurance amounts change every year. Insurance premiums change every year. So that's one of the reasons you'd want to shop around for the best price at age 65 or first eligibility, in the hopes that you keep your premiums lower, as low as possible for as long as possible. But yes, the premiums will go up likely every year. On average, that premium increase with most companies should not exceed, say, 15%. However, I have seen scenarios where a company did not have any premium increase for 1 or 2 or even 3 years. And then on that year that they do increase the premium, it goes up 40% because now they're playing catch up. But on average, most companies will have a premium increase of about 6 to 15%, and that's what I would budget for.
Are we able to change plans or is it one time?
If you can pass underwriting,
Okay,
so if you're healthy enough to pass the underwriting with any other company, you can change as often as you want, whenever you want.
okay,
There's no annual enrollment period for this kind of coverage. Once you're in, you're in. But if you have health issues, once you're out, you could be out.
okay. Thank you.
You're welcome. Any other questions?
Yeah,
Certainly.
regarding that previous question, if, so I choose a company, you know, X, and I pay all my premiums, and then 5 years from now, they decide to leave Colorado, they don't offer it anymore. Is that an involuntary loss and where I still have a guarantee to get somebody else, or do I have to pass their exam?
If that was something that were to happen, a company goes, and it wouldn't be that they would necessarily pull out of the state of Colorado that would cause that, because these plans are good anywhere Medicare is good, so they go where you go. Which means even if they no longer sell policies in Colorado, the policies they've sold are still good. But if, for example, that company goes bankrupt and can no longer be in business, and they have to drop all their policyholders, yes, that would be considered involuntary loss, and it would provide you an opportunity to be guaranteed an issue into any other company at least that same plan level. Now, if you have this kind of coverage and you move to another state, again, it goes with you, it goes where you go, because Medicare goes where you go. If you move to another state, potentially your premium could change based on whatever the rates might be for that policy with that company in a different state. But your coverage would not change and you would not lose it simply because you moved.
I was given the impression that if I went to, let's say, an Advantage plan,
Mhm.
then I decided I didn't like that. And the following year I went to, let's say I go to a G plan. And then I wanted to go back to Advantage. That is when that they do a review. But what I understand through you, they're doing a review if you switch, regardless who you switch to.
Yeah, because if you're going from supplement to supplement company, or even within the same company, a different level of coverage, from the one you have. If you're not in that guarantee issue window or in a special guarantee issue window, you are subject to underwriting anytime you want to make a change or into a supplement or try and get a supplement. You're subject to underwriting, and if you have pre-existing health issues, you could be denied. Now we're going to talk about going from a supplement to a Medigap to a supplement next, because there are different situations where that may or may not provide you an opportunity to be able to have guarantee into the supplement.
Mhm.
So we'll talk about that next. But
Okay,
yeah, if you are just trying to go from a supplement to a cheaper supplement and you're not in your 6-month window of guarantee issue, you're not in a special guarantee issue, you are subject to underwriting, could potentially be turned down if you have pre-existing health issues.
thank you.
Now,
I plan on, there's feedback. I plan on moving out of the country. Will I still be able to maintain the Medigap if I pay the premiums, even if I'm not living here?
so if you move out of the country and you have Medicare and a Medigap, would you still have to pay the premiums? Is that what you're asking?
What I wanted to know is if I could maintain them for when I come back and don't have to go through and do the medical underwriting.
If you continue to pay the premiums, if you maintain that coverage, even though you're out of the country, because if you want to keep your Medicare, you'd still have to pay the Medicare premium. If you want to keep the Medigap, you'd have to have both A and B and be paying that Medicare Part B premium to keep the Medigap in place without any break in coverage while you're out of the country. And it would still be in effect when you come back to the country. If you drop it while you're out of the country and try and get back into it when you get back into the US, you're not in a guarantee issue. So you would not get a special enrollment or have any sort of guarantee that you wouldn't have to pass underwriting to get back into a supplement. Now, if you drop Part B of Medicare when you're out of the country for an extended amount of time, that is still kind of a gray area for me. But I am getting this question a little more often than I've ever gotten it before. And I'd be happy to answer that question, but I'd be more comfortable looking up the specific regulations before I gave it that answer. So if that is a question you want me to answer, can I drop Part B, get Part B back, and then have guarantee issue into a supplement? Let me know, and we'll do that via email. And I'd be happy to share that information with everyone on this call if that was something of interest once I have that answer. So anybody who might be interested in that information, you can shoot me an email and let me know, and I will be happy to share it. All right, any other questions about Medicare supplements before we move on to Advantage plans?
I do have one question. If I'm understanding it right, if I turn 65 next year, Plan C and F are really not available to me.
Correct. Correct.
Okay. And Part B access, do you find that specialists charge more perhaps?
No, it doesn't really seem to be a matter of, is it more specialists that fall under that purview or primary doctors? And again, it's not really very common in this area specifically, but I do know that there's at least one doctor's group. And it's not a large group, but it is a group that does not take assignment. But they're the only providers that I know of in the entire county that do not, regardless of their specialty or not.
And my last question is, fibromyalgia considered a pre-existing health condition?
Yes.
Okay, thank you.
But what they're really looking for during that underwriting process is they're looking for things more likely related to any sort of heart issues, high blood pressure, high cholesterol, lung issues. They're looking for the things that may create long medical expense for a long period of time, high medical expense for a long period of time. So most of the questions are going to be geared towards, have you been diagnosed with cancer? Have you been diagnosed with high blood pressure or high cholesterol? Are you taking medications for any of those things? Those are the focus questions. If it doesn't ask specifically, are you diagnosed with something? I mean, you just answer those questions as honestly as possible, reading those questions very, very literally.
Okay, thank you
So
very much.
it may not be a denying factor necessarily, but it would be something you disclosed.
Okay, thank you.
You're welcome. All right, so that is Medicare supplements. Now we're going to talk about Medicare Advantage plans, which is a whole other ballgame. Medicare Advantage plans are policies that are offered by private insurance companies, but these companies have contracted directly with Medicare. And in that contract, these insurance companies have agreed that they're going to offer policies that act as Medicare, and Medicare is going to pay them to do that. So when you enroll in a Medicare Advantage plan, that plan basically becomes your Medicare. Nothing goes to original Medicare directly when you're in a plan, Advantage plan. Everything must go through the Advantage plan because that's what Medicare pays them to take care of. Even in that scenario, you still have original Medicare. You still have to pay the Part B premium for original Medicare. Original Medicare A and B never actually go away. They're just controlled during that time by the Advantage plan. So they are in control of those benefits, but those benefits never go away. But because these plans become and act as your Medicare, they're sometimes called replacement plans because they become your Medicare. Regardless, you still have all your rights and protections of original Medicare. They are required to cover any and all services that original Medicare would cover. But they're called Advantage plans for a reason. And that's because they typically will provide extra benefits or benefits that are not typically covered by original Medicare. Vision, dental, hearing. And the longer these plans are in existence, the more variety of extra benefits you may be offered. So hearing, dental, vision, free gym memberships, those are pretty standard. And those were the extras that most plans offered for years. Starting last year, extra benefits have become quite varied as what can and cannot be offered. Also, most Advantage plans will probably include Part D drug coverage at no extra cost. Medicare supplements do not include a drug benefit. So if you have original Medicare, you get a Medicare supplement plan, you would have to purchase a Part D separately in addition to that in order to have drug coverage. With Advantage plans or most Advantage plans, Part D drug coverage comes as part of the package. There are also some additional eligibility requirements to enroll in Advantage plans, and these are very important. The most important is that if you purchase or enroll in a Medicare Advantage plan, it must be a plan that is available to enroll in the county you reside in. That is also referred to as your plan's service area or network area. You again must be enrolled in both A and B of Medicare to enroll in an Advantage plan. And there are specific enrollment periods to enroll in Advantage plans or to look at changing from one plan to another or to look at getting out of Advantage plans. And we're going to talk about all of those enrollment periods. So, initial enrollment period. This is going to be your enrollment period that is surrounding your initial enrollment into original A and B of Medicare. The initial enrollment period for Advantage plans is the same as enrolling in original A and B. It's the 3 months prior to the month you enroll in A and B, the month of, and up to 3 months after you enroll in A and B of Medicare, typically surrounding that 65th birthday. You can enroll in an Advantage plan anytime during that period, but of course, coverage would not start until Medicare coverage actually goes into effect, which would be the soonest, the first day of the 65th birthday month. But in addition to those initial enrollment period, there are other enrollment periods that you could take advantage of every year. So every year, there is the annual election period, or what we tend to refer to as the annual open enrollment period. This is the enrollment period that has been around the longest, and it's the enrollment period that falls from October 15th through December 7th every year. Then Medicare in 2018 initiated the annual Medicare Advantage Plan open enrollment period. So this is a newer enrollment period. This enrollment period is specifically for people who are actually enrolled in an Advantage Plan as of January 1st each year. And then again, I think I mentioned, as with all things Medicare, there is always going to be some sort of exception to the rule that may fall under a special enrollment period. So again, the annual election period, or open enrollment, is what I simply refer to as it, October 15th through December 7th every year. During this time frame, if you are enrolled in a Medicare Advantage Plan or a Medicare Part D standalone benefit, during this time frame, you can get into, you can get out of, or you can switch from one to another Advantage Plan or Part D drug plan. So you can go from the plan you have now to a different plan. You can get out of that plan altogether and go back to original Medicare. Or you can enroll in these plans for the first time during that window. Any change you make during that opportunity goes into effect automatically January 1st each year. The newest enrollment period is, again, specifically for people who are enrolled in an Advantage Plan on January 1st each year. So if you, for example, decide that you're going to try an Advantage Plan for the first time ever, and you enroll in that plan in November during open enrollment, that coverage goes into effect January 1st. From January 1st to March 31st, you have an additional opportunity to decide if you want to keep that plan or switch to a different Advantage Plan, or get out of the Advantage Plan altogether because you didn't mean to do that. So again, if you're enrolled in an Advantage Plan as of January 1st, you can have another 3-month opportunity to switch to a different Advantage Plan, or decide to get out of Advantage Plan altogether and get into a standalone drug plan so you still have drug coverage. If you do not have an Advantage Plan on January 1st, this enrollment period would not apply. And then special enrollment periods. Again, special enrollment periods are typically going to be surrounding some sort of involuntary loss of other coverage, regardless of what other coverage we're talking about. So this applies to Part D, this applies to Medicare, this applies to supplements, this applies to Advantage Plans. Involuntary loss of other coverage provides special enrollment. The most common special enrollment opportunities you may get if you're in an Advantage Plan are going to be if you move or your plan moves. So if you are enrolled in an Advantage Plan, again, you have to enroll in a plan that's available for enrollment in the county you reside in. There are different plan choices for every county and every state. There are different companies that sell multiple types of plans in every county of every state. So if you enroll in a plan, an Advantage Plan, and you live in El Paso County and you enroll in a plan that's available in El Paso County, and then in September you decide you're going to move to Teller County, you cannot take the plan you enrolled in El Paso County with you to Teller County. When you move out of El Paso County, that plan must stay here. That means that you are losing your coverage through no fault of your own. It is not your fault that Medicare has decided you can't take it with you. It's considered involuntary loss. So by making a change of residence, a permanent change of residence in this scenario, when you get to the county you're moving to, whether it's within the same state or a different state, doesn't matter. When you get to the county you're moving to, you have the opportunity to either enroll in a different Advantage Plan that's available in the county you move to, or you would have a 63-day window of guarantee issue into a Medicare supplement. and a 63-day window opportunity to enroll in a separate Part D plan. The other way you might use that opportunity, the special enrollment, is through what they call the test drive that I mentioned earlier. Medicare Advantage plans are relatively new to Medicare, even though they feel like they've been around for a long time. And in the last couple of years, there are more Advantage plans than there have ever been, ever. So 5 years ago, there was maybe 6 or 7 Advantage plans to choose from. Today, there are 27 Advantage plans to choose from. Just in El Paso County, Denver probably has twice that number. Other states like Texas probably has 4 times that number of Advantage plans to choose from. And again, what plans are offered in each county of Colorado are different from what's offered in other counties in Colorado. There may be some counties in Colorado that no plans are available. So with that comes a lot of misinformation, a lot of confusion, and a lot of misunderstanding of how these plans work. Because of that, as these plans became more and more popular, Medicare started to realize that people were getting enrolled in these plans thinking they were enrolling in something else entirely, or they were getting something else entirely different, or they were being enrolled through no knowledge of their own. So Medicare came up with a solution, and it's called a test drive. And what that means is when you first get Medicare, and unfortunately, this only applies to people getting Medicare at age 65. So when you are first getting Medicare at age 65, you can test drive an Advantage plan for up to 12 months to see if that's the kind of insurance that you're comfortable with for the long haul. If you enroll in this Advantage plan when you first get Medicare, and you take advantage of this test drive, you get 12 months to write it out, to see how you like it. If at any time during that 12-month period, you decide, no, this is not for me, I would rather have gotten a Medicare supplement, Medigap, you would still have the ability to drop the Advantage plan regardless of the time of year. It does not have to be during an open enrollment period. You can drop the Advantage plan coverage and still have guarantee issue into a Medigap. The caveat here is that because you enrolled in this Advantage plan when you first got Medicare, your 6-month test drive or your 6-month guarantee issue window for a supplement started ticking when you first got Medicare as well. So if you try the Advantage plan first for 12 months, your 6 months expires. But because you're in the test drive specifically, it extends that guarantee issue into a supplement for a full 12 months. So it gives you an opportunity to have an extended guarantee issue into a supplement because you tried the Advantage plan first. Now, the downside of that is during that first 6 months of the test drive, if you decide to drop this Advantage plan, you have guarantee issue into all the same levels of coverage for supplement as you had to begin with. If you decide to drop the Advantage plan in the second 6 months of that 12-month window, you have a limited level, a limited number of plan levels to choose from to have guarantee issue into a supplement. It only drops 2 or 3 plan levels, so it's not a huge deal most of the time, but it is a little more limited if you do it during the second 6 months of that 12-month test drive. And again, that specific scenario only applies to people who are getting Medicare at 65. If you're getting Medicare based on disability or you're delayed enrollment into Medicare because you worked, unfortunately, you do not get this test drive. However, there's another way you can use a test drive. If you enroll in Medicare at any age and you get a Medicare supplement from the get-go, and you maintain that Medicare supplement without any breaks in coverage for however long, and then at 1 year during open enrollment, you decide you're going to try an Advantage plan. Everybody has one. All my friends make fun of me because I don't have one. I'm going to try it. You can drop your Medigap and enroll in an Advantage plan and still get a same 12-month window to test drive that kind of coverage, that Advantage plan out. And if you decide at any time during that 12-month window that you don't like it, you want your Medigap back, you're guaranteed back into the Medicare supplement you dropped with no questions asked. However, you're only guaranteed back into the supplement that you dropped, and the price may change when you go to get it back. So that might be something you are aware of, or ask the Medigap company about if you were to ever take advantage of that test drive opportunity. So you can use that test drive opportunity at any time, as long as you enrolled in a supplement when Medicare kicked in, and you maintain that supplement without any breaks in coverage until you choose to use the test drive, whether it's a year or 10 years down the road. Okay. Medicare Advantage plans work very, very differently than Medicare supplements. They have some additional out-of-pocket costs. Again, you must have Medicare A and B, which means you must be paying your Part B premium. Most Advantage plans in this area have 0 monthly premium in addition to your Medicare. Some of them have a premium, some of them have a small premium, some of them have, almost $100 premium, but most of them are 0 premium. If you enroll in a plan with the premium, you pay that plan premium in addition to Part B. And every Advantage plan anybody can enroll in, you're pretty much guaranteed to have other out-of-pocket costs in the form of copays, co-insurance, or deductibles. So how do these plans work? And I know we're running over time, so I'm going to try and go through this quickly, but I don't want to go through it too quickly. So how do these plans work? Well, typically, again, they have to cover any service that Medicare covers, because they are now acting as Medicare for you. Most of the time, they will include a drug benefit, although not every time. In an Advantage plan, you may be required or limited to seeing certain doctors or going to certain facilities, except in the medical emergency, where in an emergency, you can go anywhere that you need to go, and that medical emergency would be covered by any plan. But outside of an emergency, you may be limited to who you can see and where you can go. And the cost sharing is much, much different than if you had original Medicare and Medigap. And then to make things a little more interesting, there are several different kinds of Advantage plans to choose from. There are HMOs, health maintenance organizations, PPOs, preferred provider organization, PFFS plans, or Medicare private fee for service, Medicare special needs plans. There are Medicare savings accounts, although we don't currently have any in Colorado. We used to have cost plans, but those are pretty much sunsetted by the end of this year, meaning they will no longer exist in Colorado. We don't thankfully currently have any demonstration or pilot programs. We do have PACE programs in Colorado. And I'm going to talk about all of them real briefly. So, of all the Advantage plans, the different kinds of plans, HMOs are probably going to be one of the most common, been around the longest. An HMO is an HMO. HMOs can be some of the most restrictive types of insurance plans available, whether it's Medicare or otherwise. In an HMO, you are typically required to only get services from providers who are contracted with that HMO or part of that HMO's network of providers. You are typically required to only use facilities in that network of facilities contracted with that insurance. If you go out of network for services or use any providers or facilities not contracted with that insurance will not pay for those services. You have to stay in network. Typically in an HMO, you're going to be required to get referrals to see specialists or other types of providers other than your primary. You may be required to get prior authorization for some services before that service will be covered. Again, in an emergency, you're covered with any kind of plan, regardless, because it's an emergency. Most HMOs are going to include drug coverage. Very few exceptions to that rule. So as a general rule of thumb, they include Part D. PPOs were designed to be a little more flexible. PPOs have a network of providers and facilities that they've contracted with that they would prefer that you use. If you use the network providers and facilities, you're going to pay a little bit less out of pocket, but you're not required to stay in network. You're allowed to go out of network and use any provider or facility you want, as long as that provider or facility agrees to accept your plan's payment, which they're not required to do. But if they agree to accept your plan's payment, the plan will pay them their rate, but you will pay out of network a higher out-of-pocket cost. That cost is set by your plan. PPOs may or may not include a Part D benefit. Because you're allowed to go out of network, you're typically not going to be required to get a referral to see a specialist, but you may still be required to get prior authorization for some services. If you enroll in a PPO that does not include a drug benefit, a Part D, you have to have a good reason for not needing drug coverage. For example, if you are in the VA system and accessing the VA pharmacy, you could get a PPO without drug coverage and still have access to VA pharmacy. Otherwise, outside of having other source of drug coverage, if you enroll in a PPO without a Part D benefit, you simply will be without Part D coverage for the year. Fee-for-service plans were designed to be the most flexible plans because they have no network technically. So these plans do not have a network of providers and facilities that they tend to contract with. They allow you to go to any provider or facility that is willing to take the plan's payment, and your co-payment is payment in full. Because there's no network, there's no referrals required. There may be a few services that might require prior authorization, but still more flexible in that front. These plans may or may not come with Part D coverage, but if you have a fee-for-service plan without Part D, you would be allowed to go and purchase a separate drug plan so that you have drug coverage. The downside to this kind of plan is that because they are not contracted with any providers or facilities, any provider that you can find, and it becomes your responsibility to find them, any provider that you can find that's willing to accept your plan can do so on a day-by-day basis. So if they agree to take you as a patient the first time and accept your plan's payment, but then later decide that that wasn't enough and they don't want to take that plan anymore, they may not have to see you the second time. So they can choose whether or not they want to take your plan on a case-by-case basis. So there's no guarantee that you will have a provider. And again, it becomes your responsibility to find those providers willing to take that plan. Special needs plans are basically plans that are designed specifically for people who are both Medicare and Medicaid and in need of more long-term care services that would typically be covered under Medicaid. So they're designed to help people stay in the community for as long as possible by providing some additional care and services. But otherwise, they're pretty much like HMOs, and they have networks of providers and so forth. Special needs plans are very limited in where they're available, mostly along the Front Range. Anybody who wants additional information about these kinds of plans, you're welcome to call us or call 1-800-MEDICARE. Again, we also have PACE programs in Colorado. Again, they're mostly going to be along the Front Range in the more urban areas. These are also very HMO-like plans for very specific population of people who have Medicare and or Medicaid or would qualify for Medicaid for long-term care services. Again, this kind of plan is designed to help people stay in their homes in the community for as long as possible, but PACE programs provide an additional level of care. So it provides case management, it provides some social work, it provides some additional services that help those people stay out of facilities or assisted livings under Medicaid. So it provides more on-hand case management and care under that program. Anybody who wants additional information about this kind of coverage, you're welcome to contact me or call 1-800-MEDICARE. So those are the different kinds of Advantage plans that there are to choose from out there. So now you have different kinds of Advantage plans to choose from. different premiums, different whatever. The thing that's most important to remember is that they all work very similar, regardless of the type of plan, in a couple of ways. In an Advantage plan, you're going to pay a much lower out-of-pocket premium than you would with a supplement. And like I said, in many cases, Advantage plans may have 0 monthly premium in addition to your Part B premium. So you're paying much less on a monthly basis to have this kind of coverage. In exchange for that, you are going to be expected to pay a copay for almost every service you receive while you're enrolled in that Advantage plan. So these plans are not designed to pay the costs of Medicare. They're designed to provide the Medicare service, and you are going to pay something for that service out of your pocket. So you pay less on the premium side, but you pay more out of pocket when you use the services. For example, if you have a hospital stay, an Advantage plan may charge a $300 per day copay for that hospital stay. They'll max it out at 5 or 6 days, but that's still what you have to pay. If you see a specialist, you may be required to pay a $30 or $50 copay. So it works completely different than a supplement in that you pay a higher premium for the supplement every month, whether you use it or not. But when you use it, that supplement should pay all the costs. You should not have to pay anything out of pocket at the time of service. Whereas Advantage plans, you pay little or no monthly premium, whether you use it or not. But when you use services through that plan, you will have out-of-pocket costs at the time of service. So the bottom line is they're going to get you coming or going. One way or the other, you're going to end up paying something out of pocket, whether it's in the form of copays or premiums. Keep that in mind. You do have rights, specific rights when you enroll in an Advantage plan. You have the right to have access to healthcare providers. So plans are absolutely required and responsible for making sure that they are only available in areas where providers will take them. You have a right to know how those providers get paid by the plan. You always have the right to fair, efficient, and timely appeal processes, and even expedited appeal processes in some situations. You have always the right to get the care you need. You have the right to receive information about that plan and your coverage in easy to understand language. And you always have the right to have your personal medical information kept private by the plan. Again, there are a lot of plans out there. Plans have become very have increased in number significantly just in the last few years. What they offer in benefits has become much more varied, and there are many more benefits that might be offered through these plans than there used to be. But that does cause misinformation, confusion, and lack of clarity about what you're enrolling in. A lot of that, unfortunately, has to do with marketing of these plans. So there are a lot of rules surrounding how these plans can be marketed to you. And we call them the do's and don'ts. And there are unfortunately a lot more don'ts than there are do's for agents and brokers that sell these plans. But I did want you to be aware of some of the things that agents and brokers are and are not allowed to do. And if you happen to witness some of these cannots or do nots, I would hope that you would make that information available either to Medicare directly, or you're always welcome to call us and let us know. However we need to do it, someone would need to be informed that you're witnessing something that shouldn't be done. So things that agents and brokers are not allowed to do, or insurance companies are not allowed to do, is have anybody approach you in common areas. That includes parking lots, hallways, sidewalks, lobbies, waiting rooms. Nobody's allowed to approach you and talk to you about insurance that they're selling. They are also not allowed to send you unsolicited texts or make cold calls to you. Now, if you have some sort of relationship with an insurance company, even if it's not a Medicare product, but that company sells Medicare products, they can cold call you. But if you have no relationship with an insurance company in any way, shape, or form, you're not supposed to be getting those cold calls, people trying to sell you insurance. If you call them and initiate that, that's different. Companies can send you unsolicited emails, junk mail basically, and they still can send you snail mail, junk mail, which I'm sure anybody who's getting ready to turn 65 on this call has already gotten quite a bit of that. No one can use the term free when describing any Advantage plan that may have a zero premium or may have zero copays for some services. They cannot require anybody who comes to attend one of their educational presentations or even marketing events. They cannot require that you sign in and give them your name or phone number or email address. You do not have to sign anything. They're not allowed to camp out in doctor's offices or anything like that. Doctors cannot collaborate with agents to try and talk you into buying something or enrolling in something the doctor would prefer you enroll in. That's not allowed. Other things they're not allowed to do is misrepresent themselves as being from Medicare or Social Security or any other place than an insurance company in any way. They are usually not able to conduct marketing during an educational event. So you may have gotten flyers or junk mail that says Agent X is going to have a Medicare 101 at the library next month. They can do that. But during that one-on-one session, they're not supposed to talk to you about what they sell. They're supposed to tell you what I'm telling you, which is everything you need to know about everything. However, after that educational event is over, they can have a table set up and they can talk to you about trying to sell you whatever it is specifically that they sell. They're not allowed to buy you dinner, but they can provide snacks. They're not allowed to offer free items or services during any events that are worth more than $15. And they're not allowed to go door to door, period. That includes putting flyers or brochures or cards on people's door. And I have heard stories about these people, these agents getting into apartment complexes, secure apartment complexes, and just leaving a brochure in everybody's door as they go down the hallway. That is not allowed. Agents and brokers are only allowed to contact you if you contact them first, or they were allowed to cold call you and you initiate an appointment of some sort. Outside of that, you should not have to talk to anybody about anything because it's not allowed. All insurance companies that sell these kinds of plans must get all of their marketing material approved by Medicare directly, CMS. Hopefully they do that, but that's a lot of companies in a lot of states, and it's not always something that I'm 100% confident that happens. But Medicare is supposed to get all marketing materials for review and approval. They're supposed to comply with do not call registries. I don't know if you guys are familiar with how well those registries, both the Colorado or national, work. Sometimes they do, sometimes they don't. They are always required to get permission to contact you. And when you do talk to anybody, specifically if it's to talk to you about a specific product, they are supposed to either have you sign what's called a scope of an appointment or verbally go over a scope of appointment that tells you that they're only allowed to talk to you about a specific product. And if you want to talk to them about any other type of insurance that they may sell, after that appointment, you would have to wait till that first appointment is over, and they would have to do a new scope of appointment to talk about any additional type of insurance. I don't know how well that works. I'm hoping that they're more keenly aware of having to do that than I'm afraid that they are. If anybody sits down with an agent for any reason and is not advised of a scope of appointment or given that paperwork to sign, please let me know. And that's just the tip of the iceberg of what they're supposed to do or not do. I did include a handout that I had some additional information about do's and don'ts for marketing of these kinds of coverages. Please peruse that. And again, if you see anything amiss or witness or experience anything that is under the don't category, please let us know. So that's kind of Advantage plans in a nutshell. Again, work totally different than Medicare supplements. Medicare supplements may not be for everybody. Advantage plans may not be for everybody. Things to think about if you're thinking about Advantage plans, just a few questions I want you to ask yourself. Because most Advantage plans include Part D coverage, make sure that whatever plan you're considering covers your specific medications. We're going to talk about this more next week, but every Advantage plan that includes a drug benefit is going to include a different list of drugs than the other guy. So if there are 27 Advantage plans in Colorado Springs that have drug coverage, every one of those 27 plans is going to have a different list of drugs that it covers. Same with standalone Part D plans. And again, we'll talk about that in more detail next week. But make sure whatever drugs you take are covered specifically by whatever plan you're looking at. If you have doctors that you want to keep, make sure that those doctors accept whatever plan you're considering. If you enroll in an Advantage plan and you find out after the fact that your doctor does not participate, you cannot continue to see that doctor if you want your insurance to pay for it. If you have a hospital network preference, we only have 2 in this area. Some people in the past have had very strong feelings of using one over the other. These days, it may not matter, but if you have a preference, find out what hospital network any of the Advantage plans may contract with. If you see a lot of specialists, does your plan require that you get a referral every time you want to see your specialists? HMOs may require that you get a referral every time you see a specialist. So if you have 3 specialists, you'd have to go to that primary doctor and get a referral every time. That may be something that you want to consider. I know a lot of these plans and a lot of commercials and a lot of junk mail and a lot of snail mail may emphasize some of the extra benefits that these plans might offer, such as, you know, a $75 credit to shop online for pharmacy goods like Walgreens, or may offer transportation benefits or a grocery voucher, or, you know, any number of things that these companies are allowed to offer. They may offer, you know, meals after a hospital stay delivered at home, or, you know, it could be anything these days. If those are the benefits someone is focusing on, and they're not talking to you about the costs, they're not talking to you about providers or your drug coverage, that should be a red flag for you. You need to know all of those things before you enroll in a plan. So don't let the bells and whistles distract you too much. Make sure you know, if you're going to enroll in a plan, know what your costs are out of pocket for copays or deductibles. Make sure your drugs are covered. Make sure your providers are going to be adequate. That's my best advice when it comes to this kind of coverage. I included a couple of handouts for Advantage plans in the email I sent earlier. This first handout I think is amazing. It kind of goes into a little more detail and gives you a pros and cons for each type of Advantage plan available. It's a really good handout. It's easy to understand. Please look through it. It gives you a little bit more detail than I may have been able to have time to give you here. The second handout I provided was this one. This is what we pretty much call our at a glance. So this was originally created by one of my volunteers that I no longer have, but I was able to update it for El Paso County for this year. It lists all the Advantage plans available to enroll in El Paso County for 2022. Tells you what kind of plan it is, HMO, PPO, etc. Tells you whether or not there's an annual deductible, if there's a monthly premium. Tells you kind of what the copays would be for your primary doctor or your specialist or a hospital stay. Tells you if it has a maximum out-of-pocket amount. So that limits your out-of-pocket liability in a plan like this. If you have, you know, a lot of medical needs in a year, tells you what the hospital copay is. And it goes as far as to tell you what hospital networks each plan may participate with. Luckily, these days, most plans have chosen to participate with both hospital networks in Colorado Springs, but not all of them. So it's kind of an at-a-glance handout that kind of shows you, you know, all the plans all at once. And you can kind of just go up and down the numbers and compare some costs for that kind of coverage. All right, so that is Advantage Plans in a nutshell. I know we're running over time, but I appreciate you guys hanging in there. Are there any questions about this? Nothing? All right. Well, let's wrap it up then so I can let you guys go. We talked very briefly last week about the Medicare savings programs. These are federally funded programs that help pay some of the costs of original Medicare. So Medicare savings programs, specifically if you are eligible based on income and assets, it may pay the Part B premium for you so that $170.10 is not deducted from Social Security, or you don't have to pay it directly. But again, it is based on income and asset levels. For 2022, I've indicated those numbers in pre-deduction dollars. If anybody is interested in any additional information or would like assistance applying for this program, we help with that at our office, and just give me a call or shoot me an email. And that, I believe, is it. I know that was a lot of information. Again, I appreciate you guys hanging in there. If you have no other questions for me this evening, please be aware that you're always welcome to email me with any questions you might think of down the road tomorrow. And I'm always happy to answer questions. You're also welcome to try and call me. But you could talk to any of our Medicare counselors that might be available. Just real quick, our office also acts as the Senior Medicare Patrol Department. Again, that's going to be what we look at if someone calls me because they saw an agent broker approaching people in the parking lot, kind of thing. That's under the Senior Medicare Patrol, but we do that in our office. Again, contact information, email me at this email address if you have any questions or need any clarification, or just even if you want to schedule an appointment. Again, you're welcome to call us at our Colorado Springs number or even our toll-free statewide number. It'll route you to our office if you're calling from any of our 9 counties. I have currently 4 full-time experienced counselors, 1 in training. I have 2 part-time volunteers, getting another one onboarded. So there should always be someone available to answer questions for you if you want to just call in. And that is it. I appreciate you guys attending tonight. Let me know if there's any other questions or concerns I can help with. Another last minute just announcement. Our agency also offers, let me see if I can get this up. Our agency also offers other educational presentations. And we have one series of presentations coming up, actually starts Monday, and we call it our retirement series. And this is a 6-week, 6-part course that goes over a lot of the different aspects of retirement. So Monday, I will be doing a much more abbreviated version of Medicare 101, where I try and cover it all in an hour. The week after that, they will have someone talking about estate planning, wills, living wills, powers of attorneys. The next week is retirement by design. That's a wonderful presentation. Making the golden years golden. That's going to talk about retirement savings. We will have a representative from Social Security come on week 5 to give you an overview of Social Security benefits. And then the last week will be the meaning and purpose of retirement, trying to help you and give you ideas on how you want to retire and what you want to do in retirement to have a fulfilling retirement. Very wonderful series, also at no cost, will also be via Zoom. If you want to register for this series, you can go to our events page like you did to register for this series, just ppacg.org/events, and register for any and all of those sessions. It's a wonderful series we do in partnership with Ent Bank. And so they may also be advertising it to their members. But again, if you have any questions, you're welcome to call us and we're happy to talk to you in more detail about that. But really good sessions if anybody's interested. Other than that, I will let you all go for the evening. I appreciate your patience and your fortitude to hang in there with me. Hopefully I will see you all next week when we talk about Part D specifically. Other than that, have a good night. Let me know if you have any questions.
I got the slides that you were showing about these upcoming events, that wasn't in your presentation slide, was it?
It was not. This is a separate flyer. I'm happy to email this out if you'd like.
Is it part of your normal? I mean, I got the 6 attachments earlier, but
Yeah, no, I didn't.
was that
include
included?
this flyer. I did not include this flyer, but I'm happy to
Well, I
mail
would
it.
like to have it.
Yeah, I'm happy to email it out to everybody if that's okay.
Yes,
That'll be
please.
good. Thanks.
Absolutely. I'll just shoot it out to the everybody who registered for this class, just in case somebody wants it. Happy to do that. Absolutely.
I had one more question. I have a health savings account and I want to be able to use those funds to pay for supplemental premiums and any future healthcare costs. Are there any rules on that I should know about?
There are rules regarding Medicare and the use of health savings account funds. Obviously, when you enroll in Medicare, you're not allowed to contribute or continue contributing to a health savings account, but you can continue to use those funds for medical expenses. I don't know all the specifics, but there's an inkling in my head that raises a red flag when you say use it for supplement premiums, that
Okay.
may not be allowed.
Okay, I'll
if-
check that.
Yeah, I would double check that. You might check with, whoever you use for tax prep. If you can't get an answer from anybody else, shoot me an email
Okay,
and I will find an answer for you.
great. Thank you.
You're welcome. And yes, I'll just go ahead and send that flyer to everybody here in just a few minutes. All right. Thank you, everyone. Have a good night and hopefully I'll see you next week.